The data gathered from both staff and service users during our evaluation of drug and alcohol support services showed clear support for maintaining a remote service offer and combining that with in-person appointments. We recommend that drug and alcohol treatment support services provide a mixed or hybrid service offer going forwards. Here's what was said in support of this. Staff and service users expressed having experienced improved efficiency during the pandemic, while most of the service was offered remotely, either by phone or video call. There were reduced waiting times, fewer people missing appointments, and service users reported a more pleasant environment when they did have to go into buildings because there were fewer people hanging around. It was often a less stressful experience simply taking a call or getting on Zoom than having to travel. Having the remote offer as an option can support trauma-informed care. For example, someone suffering severe social anxiety can receive support from their own home. Combining both in-person and remote service offers means that the service has another way in which it can tailor care to meet the varied and sometimes complex needs of drug and alcohol service users. It's another string to the bow. Service users taking opioid substitution medications were trusted in greater numbers than before the pandemic to pick up their scripts from pharmacies less often. For most people, this worked well and felt like an improvement to their service experience. Reduced frequency of medication pickups and remote service offers both offer an opportunity to acknowledge and show trust in service users who are doing well with their recovery. Remote service offers are not right for everyone. We found that factors which should be considered when making a decision about offering remote provision include the mental and physical health of the service user. For example, a physical health problem or a disability may make it hard to get to an in-person appointment. Alternatively, someone with a mental health problem may struggle to engage remotely. People need to have the right resources to access the support they are being offered. We go into this in another infographic and video in more depth. People also need to be ready to tackle their substance use and commit to the process. Their preference for a remote offer, or not, is also very important. Although many service users really liked accessing services remotely, some people were happy to access things that way when that was the only option, but would much prefer to do things in person when possible. So it's important to make that available. Social support through group work may be particularly helpful when in person. Some service users are dealing with such complex problems and are so vulnerable that they need more than an in-person appointment. They need services to go to them, either at home or wherever they are. Some parts of drug and alcohol support services are better done in person, and some things can only be done in person. For example, tests for blood-borne viruses and urine tests cannot be done remotely. Things like comprehensive assessments at service access are better done in person, as this can reduce additional administrative burden for staff later and can form part of the rapport building that is necessary for optimal care. Having a remote offer can increase accessibility of services for some groups. For example, people with caring responsibilities and those who work are much more likely to be able to engage with support when offered remotely. Even when care is planned to be mainly delivered remotely, It's important to try to hold an early in-person appointment if possible, to help build trust, rapport, and a therapeutic alliance. In order to check on safety and well-being, an in-person appointment or an outreach visit is best. People were able to hide things from services more easily during the pandemic, and someone experiencing domestic abuse may not feel safe to disclose this remotely.